Hannah?
This meeting is being recorded.
Thank you, and hopefully you'll have heard that. The meeting's been recorded as usual. Please feel free to ask any questions that you like in the chat or in person, however you prefer. Next slide, please. And here's our agenda. It's quite short this week. We've got the usual update from Anna Hartley. We've got some updated guidance from George Butler, and just a quick slide from me about some pharmacy services consultation. Next slide, please, Hannah. So it's over to you, Anna. Thank you.
Thanks. Could I have the next slide, please, Hannah? Yeah, so this kind of indicates quite well where we are now. So what's happened is, you'll remember that pre-Omicron, we kind of settled around 400, between 400 and 500 per 100,000, and we were pretty steady, as you can see from that straight line. And then we've had that huge peak with Omicron, and now we're kind of plateauing again. The real challenge is at what level do we plateau, or as my Public Health England colleagues are calling it, where's our sort of cruise control, where's our sort of flying altitude now? And unfortunately, it looks like it's going to be that bit higher than it was before. So you can kind of see we're coming at about 900 per 100,000, and it's sort of stuck there. So we'd really hope that would come down a bit, because obviously that's much higher than it was previously, but we're kind of waiting to see. So some of the other things that have also seemed to have come to a bit of a plateau is things like staff absences. So again, though they were really high, they've come down a bit, but they've not really come down where we'd like them to be. Next slide, please. So obviously, positivity is quite an important thing at the moment, and that's because you'll be aware there's been a number of changes around people getting PCR tests. So for example, if you get a lateral flow test and you're asymptomatic, you won't necessarily get a PCR. Also, I think people are probably, there is a bit of testing fatigue, so we're perhaps not getting as many people going for tests. Obviously, if you've got symptoms, you absolutely should go for a PCR test, but a lot of people I know I'm hearing are kind of just doing a lateral flow test, and if it's negative, sort of taking it as a negative. What you can see is that positivity, which is a really good indicator of whether we're doing enough testing, has gone down, but it is still, again, it seems to be plateauing much higher than we would want it to be. And if you look at the testing data, which is that right-hand graph, again, that testing's really going down, and really we shouldn't be seeing that testing reducing as much as it is, given that our positivity rates are still so high. So you'll remember that back in the glory days, we were looking, that was below 5%, and that was where we wanted it to be. Well, it's nowhere near now. Next slide, please. So again, you can see sort of with those age groups that we've still, fortunately, we are still keeping those older ages relatively low, but still we know that despite the fact that a lot of the kind of media story is about Omicron being not as serious as perhaps Delta. However, if you're unvaccinated and you're vulnerable, that it can still be serious, so you can still get quite ill, and so particularly we want to make sure we're keeping those age ranges low, the rates in our older age range low, and they're not as low as we'd want them to be at the moment. Next slide, please. So again, this is not, again, nobody wants to see this looking like this, and it just really demonstrates that right through all the age ranges from the 0 to 4, right up to sort of our 80 pluses, it is much higher than we'd want it to be. And unfortunately, particularly in that older age population, that will translate into people getting very poorly, and into hospital admissions, and sadly, ultimately into deaths. And this is a huge, my guess is this will be quite a big underestimate as well, because we know that not everyone's going forward for tests in the way that they were previously. So next slide, please. So again, this is an important one to look at, as I've just described, because it's that older population. So that kind of green line is your 80 pluses. And the sort of the blue lines is 60 to 79 year olds. So that we saw that really big jump, and then we have seen that go down, but again it looks to be plateauing a little bit higher than what we'd seen before. I think it's testament to the incredible success of the vaccination programme. Particularly, we know that if you have the booster, that is a good defence against Omicron, certainly against getting really poorly with it, and that will, when we go on to the next slide, and actually if you just, Hannah wants to go on to the next slide, we get to yeah, and then that's the working age population. But if we get on to the next slide, I think it will show us eventually we'll get to hospital admissions. So again, you can see, I will just point out a few things with this children's slide. You can see with children, any of you have got a primary school age child will recognise this at the moment, that those rates within primary schools are still much higher than we'd like to see, and those were until very recently continuing to rise. And certainly my daughter's primary school, not a day goes by without us getting a letter from the head about more children that have tested positive. And that isn't something we were seeing at the beginning of the pandemic. We remember we weren't seeing a lot of infection in that age group, but we are really seeing it now. And you can see how that the 17 to 18 line has really fallen because they've now been vaccinated, the majority of those children. And that blue line as well, you can see that we've seen that much higher reduction where those 12-year-olds, so some of those children have either just turned 12 or are not 12, so they won't have had the vaccination. But you can see how the widespread vaccination campaign has diluted those positive results. So next slide, please. Yeah, we won't, let's go on to the next slide. I think we've talked about that already. So again, you can see that for some of our wards, very, very well, to be honest, for all of our wards, very high rates. And some of our wards, you know, Wakefield East, for example, that was between 11th and 17th of Jan, 1,451 people. I know Chris is on the line. I expect you are very well aware of that, being where you are. We've also got, and even the week later, you can see that the rates have gone down a little bit, but they are still extremely high. Yeah, so next slide, please. Again, you know, we look at this because it's a really good view of kind of what's happening across the district. We don't want to see any purple. We'd far rather that was kind of green or blue, but it's not. So very, very high rates right across the district. Next slide, please. So again, this is interesting, like COVID patients, how have those incredibly high rates translated through into people actually going into hospital? You can see that we do have quite high rates still within hospital, nothing like as high as we had back in sort of October, November, pre sort of booster, proper vaccination, but still higher, definitely higher than we'd like, and those do put pressure on the hospital. Next slide, please. And again, you can see those deaths still coming through, again, much lower than we'd seen before. And again, that's testament to the vaccination campaign. And just a really quick note, because I know it's been in the news as I'm on. I know there was that was really misleading fact about low deaths from COVID, just to point out that none of those deaths included any other factors. So, for example, if you were obese, they didn't include it. If you had underlying asthma, they didn't include it. So that was a very misleading story about there being many fewer deaths from COVID, because actually, you know, people, especially in Wakefield, you know, once you're over 55 in Wakefield, you're highly likely, you know, we see high prevalences of long-term conditions. You wouldn't have died of those long-term conditions. It is COVID in combination with that long-term condition that has meant that sadly, you know, those deaths have occurred. So I think it's just important to point that out on this slide, that it is, you know, that the accurate data to look at is the data where COVID was the cause of death, and not where COVID was the only cause, because that's where you're talking about much younger people who very, very sadly died of COVID and who had no underlying risk factors at all. But the majority of us will have risk factors, whether that's being overweight or being a smoker, for example. So I think that's the end of my slides there. Oh, sorry, vaccination and data. Yeah, so again, we're doing very well with vaccination. As you can see, some of those lower ranges, we're still sort of, obviously that we're still sort of catching up with those, but generally overall, really, really, really impressive rates. I suppose that can sort of mask, the overall rate can mask particular bits of the population that have had lower rates overall. And I know there's still a lot of work happening on that in Wakefield district. And I was talking to Joe Fitzpatrick this morning, who was the vaccination SRO prior to Sarah taking over, and saying that that one of the reasons why the vaccination campaign has been so successful in Wakefield district is because of the support of things like the community champions and also other people, where they've been able to have the conversations about why do people not want to be vaccinated and what were their concerns, and then listen to them. And she was sort of saying that that was sort of one of the key reasons why we've had such high vaccine uptake here. So it's kind of really heartening to hear that. Next slide. Yeah, so just, I don't know if there are any sort of specific questions or comments from anyone. Can't see
I'm just
anything.
looking in the chat, and there's no questions in the chat. Can't see anybody's hands up, so I think everybody's comfortable with that.
Excellent, thanks.
Yeah, thank you very much, Anna. We've got George Butler now from our communications team, who's going to talk you through the next few slides.
Hi, good afternoon, everybody. So in the light of the changes in restrictions moving from Plan B back to what's called Plan A, so which is the situation prior to going into Plan B in December. So we've launched a campaign that we're calling Be Kind and Be Caring, and it's all about getting across the message that we need to think about others, and the fact that there may be people that are still worried about COVID and worried about the fact that case rates are high and that they may be vulnerable and at risk. So we've created this asset, and then if we go on to the next slide, we've also created this one, which is out on social media at the moment. So what we did was, when the restrictions changed on the 27th, we put out the Be Kind messaging. If you go to the next slide, with this social media post on Facebook, and we've done it as a paid advert, so with the intention of reaching more people. And so we put that out on Thursday to Sunday, the Be Kind, with the Be Kind asset, and then we've switched it at the start of this week, so going out from Monday to Friday, with the Be Caring asset, and we're going to then take a view of which was the most successful, so we can compare the two with the same messaging to see, you know, how effective our messaging is. But like I say, you can see it's all about thinking about other people, just getting that into people's minds, you know, that some people may have worries and concerns, and to take care of others in the community. Okay, next slide. And we've got a campaign coming up, a Valentine's campaign. So I've got a sort of a sample of the assets that we've created. So we've got this one with the family, and then next slide. We've got this one with a young lady in a wheelchair, and then next slide. We've got a sort of a grandma with a granddaughter. So next slide. So they're all along this theme. Now the plan is that we're going to do a social media campaign on Facebook and Twitter. We're going to do some paid social media again to try to increase the reach. And what we've done is we've commissioned a poem by a professional poet. He's writing it at the moment, and we should get that in the next few days. And then we're going to put together a video of different volunteers who record themselves reading one or two lines of the video, and then we're going to get all those videos and compile them into one and put them out as part of the campaign on social media. Okay, next slide. So this is a bit of an appeal from Ebony, who's new to the team. Ebony is working on the Valentine's campaign, and what she'd like is anyone who would like to get involved and be prepared to do a video for us reading part of the poem. And if you would like to get involved, Ebony's email is there on the screen for you. If you email her direct and let her know that you'd like to be involved, she will then get the poem to you and work out the details of getting the video back from you and advise you on how to do the video and everything like that. Okay, that's the end of the presentation from me. Thank you.
Thanks very much, George. And I did send round an email from Ebony, and I think we got about 5 or 6 respondents from the COVID champions who copied me in to say I'd happily do it. So I do know that already we have got some champions. So thank you for those already. Pam, you've got your hand up. You're on mute.
I was wondering if I could just ask George whether they just want champions and volunteers for this role, or whether to give a broader range of the population, whether some school children might be able to record a line or two.
That would be fantastic. Yeah, definitely. We want as diverse a range of the community as possible, really. So if we could get a group of school children together reading it as a group, that would be fantastic. We'd love to have that. Yes.
I'll have a word with my grandchildren and see what I can do.
Okay, that'd be great. Yeah, thank you, Pam.
Brilliant, thank you, Pam. And as George said, Ebony is really keen to reflect that Wakefield district as a diverse district of all sorts of people from all sorts of places doing different jobs, all age ranges, ethnicities. She welcomes all of that. So if anybody else would like to volunteer, please contact Ebony or just give myself a nudge, give me an email or phone me and we'll send the details out. Thank you. Next slide, please, Hannah. So this is my bit. Wakefield Council is wanting to hear your views on how you access pharmacy services. I believe I've sent this out as an email as well, but the survey only takes about 10 minutes to complete. It's now open and will close on the 15th of February. There are no right or wrong answers to the question. It's just about how you access the services, what services you access, and as ever, we try to make improvements wherever we can. So if you can have time, please, we'll send the link out in the after email so you can just click on it. But if you can take time to do that, that would be very much appreciated. Thank you. Do any of you have any other questions or comments that you would like to make? I know it's been a whistle-stop tour. No, nothing in the chat. I think we can possibly end on a high note then, if my colleague Kerry, if you'd like to share your little joke that you shared with me before the meeting.
Thanks, Tracy, put me on the spot there. So why don't ants get COVID? Because they have lots of little antibodies. That's all I've got. That's all I've got.
Well, on that cheery note, thank you everybody for joining us this week. We'll be back in a couple of weeks for another update, hopefully some better statistics to share with you, fingers crossed. Keep yourself safe and keep getting tested. Thank you very much. See you soon. Goodbye.
Thank you.
Bye, Richard.